What is autism? What is executive function? What is a disorder? Are we supposed to be talking about disorders when it comes to conversations around neurodevelopmental challenges, neurodiversity, neurodivergence? I am so excited for my conversation today because it is going to answer so many questions that you have about autism, ADHD, neurodiversity more generally. Oh my goodness, let's get into it. Hello and welcome to the Happy Families podcast. My name is Dr. Justin Coulson. This is where we give you real parenting solutions every day on Australia's most downloaded parenting podcast. I wish Kylie could be with me today. Unfortunately, she has other things that are going on with our 6 daughters. Therefore, it's me, but I'm joined by somebody who has taken the world by storm academically over the last couple of months with a brand new paper that was published all about autism and executive function. If neurodiversity and neurodivergence are common discussion points in your home, this is one you don't want to miss. Professor Adam Guastella is a leading clinical psychologist and researcher at the Brain and Mind Centre at the very prestigious University of Sydney, one of those sandstone universities. Groundbreaking work for decades now in research. He's also featured as the expert on the ABC TV show Employable Me, which was about helping autistic people find gainful and valuable and meaningful and purposeful employment. He's working on providing support and tools for families with neurodevelopmental needs. He's a dad to 3 boys, and he joins me now from his office at the University of Sydney. Adam, I'm so excited that you're on the Happy Families podcast today. Thank you for being with me.
Hi, Justin. I'm so glad to be here.
Adam, let's start with a conversation about you. Why study autism?
Well, I trained as a psychologist, and for anyone that's trained as a psychologist, they'll know that they barely got any training in this autism field. I think my memory is I got 2 hours of a lecture on fairly basic information about autism and other neurodevelopmental conditions. And so what happened for me is I actually started in anxiety, doing a lot of different anxiety treatments. And we used to get people come into the anxiety programs and they'd benefit from some things, but they really weren't benefiting from a lot of parts of the program. What's going on here? I started realizing there was different needs for, this group of people that were coming in. And we started understanding that they were people that were meeting the criteria for autism, actually. They weren't often undiagnosed, I might add. So they'd be coming in really significant problems. And so, from there I went, well, we've got to support this group in a different way. And there was nothing available. There was no evidence for what works. There was no health service providing support. And so that's where it really started. I went, well, actually, we've got to develop the evidence for how to provide support. And that started back in 2008, and we've been continuing ever since.
What is autism?
Well, it's a good question. It's a controversial one, I might add. There's a breadth in the way that we define autism, but the crux of it is really a difficulty in navigating social situations in terms of the core criteria, and then having a systematizing or really black and white way of thinking about the world and getting stuck in routines. That's sort of how the criteria is shaped at the moment. Okay,
so let me restate that. I'm going to use the term disorder. I know it's a provocative term, but for just now, I'm going to use the term disorder. It's a disordered way of engaging socially. It's a fixed and rigid way of sticking with routines or demanding routine where it doesn't exist. And sorry, there was a third element that that's just escaped me. What was the third element?
It's the black and white. It's sort of what we call concrete thinking. It's sort of like seeing things in quite rigid ways.
Okay. Yeah. You didn't mention anything about intellect, cognitive capacity. And this is another area that can be quite provocative. My understanding is that there is no correlation between autism and intellectual capacity, that it's very much about rigidity in thinking and struggling in social situations.
You said disordered ways of interacting socially. I know you're being provocative, but that's where the debate is, right? Because the debate is it about they've got a disordered way of interacting, or that there's just a different way of interacting that if we can support or match is not really disordered, but just different. So that's an active debate in the field right now. But to go back to your actual question, think about it as a condition that's associated with changes in learning and behaviour that affects socialisation and the way we interpret information in our world.
The Oxford University Press describes a disorder as an illness or condition that disrupts normal physical or mental functions. You've highlighted this as a provocative thing to anyone who is dealing with autism. And I say dealing with because there is disruption socially and there is disruption around that rigidity of thinking. The affirmative approach, the affirmation approach is very much where the conversation is right now. Why is this so provocative? It seems to me, and granted, I'm not somebody who's been trained in it, and I also have all the compassion and sympathy in the world here, so I'm not trying to, I'm really not trying to stir the pot. I know anyone who's dealing with autism in their family is right now hating me, but I'm asking the question because Grandpa Joe or Auntie Cynthia at Christmas, they're not thinking the way the mum who's grappling with this is thinking. They're not thinking the way the person who's leading the autism organisation is thinking. They're saying, but you've got a 9-year-old who has a condition that's disrupting their normal physical or mental functions. They're saying this is a disorder, right? So as provocative as it is, I'm taking that side because I want you to be able to explain why this has turned into this big debate. Why is this such a big debate?
So I think it's important to acknowledge the history, and the history is that we need funding mechanisms to provide support in different governments rely on a medical model to provide funding to a family for needs, right? And so that is often under the label of a disorder, and that's where private health insurance and the like all comes into it. And so the term disorder is actually very, very important for accessing healthcare. The issue in this space really is that it's not all about changing the child, which the term disorder sort of insinuates that it's something we have to fix in a child to get optimal health outcomes. And the answer is certainly not that, right? It's about actually going, what in the environment needs to change to make the environment easier to learn from? What in the environment needs to change to encourage more cohesive and more supportive interactions with people and better friendships? And also what in the environment needs to change so that people can succeed in achieving the goals they want to achieve? And so the focus is very much on helping the individual, but also recognizing that the environment can change in a huge way as well. And related to that, when people have done studies and changed environments to be more what we term inclusive to support children and adults with autism and other neurodevelopmental needs, those environments are really good for everyone. Like all of a sudden we start seeing improvements in learning outcomes for all the kids in the class, not just the kids that have a neurodevelopmental condition. So then the question becomes, are we dealing with poor environments that are unnecessarily difficult to learn from, mixed with differences in learning that make things result in problems? And I'll give you some really practical examples. In our clinic, we regularly deal with young adults that come to us. They aren't able to find work. They might be failing at university. That they might be really unhappy in their jobs, and we'll explore what's going on for them. In the university system, we know that it can be really sporadic in terms of the amount of work that's required and self-driven. And a lot of the assessments can be really hard to navigate for people. And so it's not hard for an assessment to get missed here or there. That the minute they start failing at one thing, then it starts piling up. And it's before they know it, they're starting to fail at all their subjects.
Sparks the anxiety that you were talking about before.
Yeah, and anxiety starts kicking in, depression starts kicking in. And so the system, in the way that, say, you're learning about how to complete a course at university doesn't suit or it doesn't promote often successful outcomes for people. And so we've taken some of these people that have reported really poor outcomes and then put them, or not, they've won jobs themselves, but put them into roles where supports exist and where their needs are being met. And maybe the structures are clearer, maybe the goals are more obvious, maybe the tasks are more suited to what their skills are. And what do we find? Well, we find frequently that when you do that, people succeed and succeed outrageously well. So we've had people that are failing at university to being in the top 10 of early graduates in a multinational company for the year and getting to meet the CEO, or people that were absolutely miserable because they got the diagnosis of autism in the workplace, put them in the back office and felt like that, and they felt like they were being mistreated, and they were. to then becoming the head of diversity inclusion in a major company, or getting a job in government representing the needs of people in the NDIS. And the point is that it's not necessarily that these people have a disorder that stops them from being able to learn or being able to succeed, but it's also about being able to match up what their goals are with the environment so that they can flourish and succeed in the future. And that's partly why there's been this shift in narrative.
Adam, my sense is that what you've said is going to give so many parents so much hope. I'm getting goosebumps on my arms listening to what you're describing here.
One of my sons has ADHD, and when he was in year 2, the strategy the teacher applied for him when he wasn't able to sit still and listen in the class was to face a blank wall at the back of the room while she taught, right? So her strategy was to get him out of the class, and so he was being, if you like, less disruptive, to face a brick wall. The idea there is he's being disruptive, and if he wants to learn, he needs to sit in the class appropriately and face me appropriately.
Yeah.
And if he doesn't do that, he's facing the brick wall, right? How much does he learn when he does that? What does he learn about his role in the classroom when that happens to him? What does he learn about his worth as a child because he's got the problem? And so, what we quickly did when that started to unfold was to get him into an environment where the right supports were put in place, that, the distractions in the classroom were reduced, that perhaps he was given, appropriate support and learning support on a regular basis to be able to take in the information, and the anxiety in the classroom reduced. So I guess that's sort of the point of why we don't necessarily just talk about disorders.
As you describe that, it sits really neatly with the psychological theory that underpins most of my research and most of my work, which is that when children's basic psychological needs are supported, they thrive. That is, when they feel competent and capable, when they have good relationships and they have a sense of control. And your son's experience, much like my youngest daughter, similar kinds of challenges. We homeschool her now because we just found that the school environment was not working, and we're fortunately in the position where that was an option for us. There was just too much disruption in her life. Relationship with the teacher, relationship with other students, explosive, not working, not feeling competent because always getting in trouble, and also being controlled so much. I love the way that you've mapped that out, and hope that's there for parents. Last provocation before we step into what I think parents are really going to want to know about as it applies to their own children. I hear this with some consistency, and it's certainly something that I've thought of as well. I went to school in the 1980s, graduated in the early 1990s. My experience with school was that I don't ever remember ever coming across kids with autism, maybe ADHD because we just didn't talk about it back then, but I don't remember ever coming across kids with these neurodevelopmental needs, conditions, disorders, whatever word people feel most comfortable or uncomfortable with. I try to be sensitive here. I just don't remember anyone with autism in the 80s and 90s. Has something changed? And if so, what? Because a lot of the aunties and uncles and grandparents are looking at parents today and saying, well, it's dodgy parenting. It's faulty. You're the issue here.
Yeah. And I think that goes back to this idea that there's a problem that needs to be fixed and someone's caused that problem. And I think that's really unhelpful because, we know that neurodevelopmental delays and conditions, it's not about parenting in general. And so, there's a very clear reason why. When I started training as a psychologist in the late 90s, early 2000s, the rate of autism was about 1 in 100 and something, 150. So that means in the average year level, there might be one person that was being diagnosed. Those kids back then would never have been diagnosed because the criteria didn't meet that criteria. A lot of the kids back then needed to have intellectual disability, quite severe intellectual disability, to be diagnosed. And secondly, a lot of those kids, I've reflected on that myself, and I can think about a lot of the kids in my year level that probably would have met criteria for autism but never received an assessment, never received any support. And it's fine to go, well, okay, well, if they didn't receive support back then, why should we give them support now? Why not just let them be whatever they be? And the answer to that is pretty simple. It's that when you don't provide the right support, when you don't give people the needs that they have, then you get poor outcomes. We know that autistic people and people with ADHD have enormously high rates of bullying in schools, enormously high rates. They are victims over and over and over again. And it's a consistent story of trauma and dislike of schools in regards to their peers for a lot of young people. And so we also know that underachievement, particularly in those later years, is very, very common in comparison to their cognitive ability. When you do an IQ test or the related things to IQ, you may say this is the type of HSC score or whatever score you would predict. And we know that people on the spectrum will often get much lower scores than that. And it's not about their learning capacity or their intelligence. It's about what supports they had at school to be able to learn in the types of things I said earlier. And so if we're happy for people not to succeed and fulfill their potential, if we're happy for people to be excluded and to be bullied in our schools, and we're happy for people to underperform and then to have what is often lifelong self-esteem issues and difficulties then moving on into other fields, then yes, we should leave things the way they are. But if we want a different system with greater awareness, a greater knowledge of what differences people have, what needs they have, we should develop schools and learning opportunities that give people the best chance at succeeding in life. And I think when Granddad's talking about it, Granddad's talking about a medical model that goes, there's something wrong with your child, you've got to fix it. We're talking about a model now, which is all about, we just want the best outcomes for your children. We want to make sure they've got the right supports in place. And if we do it for the kids that really need it, I bet you the other kids are also going to benefit. And that's the model that we're talking about.
Professor Guastella is at the University of Sydney and joins me on the Happy Families podcast today. My sense, a metaphor has sprung to mind as you've been describing this. I could listen to you talk all day. And that is that if you get a seed and put it in the soil and the seed doesn't grow, do you blame the seed? And most gardeners would say, well, no, you don't blame the seed. You look at the environment, how much sunlight's there, what's the temperature, what's the nutritional quality of the soil, how much water has been put into the soil. In other words, you adapt the environment to help the seed to grow. Would that metaphor suit where you're going here?
That metaphor absolutely does. And I think it's even more charged if you say, would you blame a 3-year-old for anything?
That's right. Yes.
Would you blame a 5-year-old for all the things we sometimes do blame them for? I mean, these are children that need support.
Adam, a few months ago, you published a paper that it blew up. It caught my attention. It's pretty academic. It's pretty full on.
Yeah.
But as simply as we can, I want to dissect a couple of things from it and talk specifically about this thing called executive function.
Yeah.
My very brief summary of the paper is that you've identified that across neurodevelopmental needs, across the great neurodiversity that exists on the planet with young people, one of the factors that brings them together is an issue with executive function. That is, executive function for autistic kids, children with ADHD diagnosis, people who meet the criteria in the DSM for these neurodevelopmental challenges and needs. Executive function seems to be right at the core of it. Now, I know that that's a massive oversimplification of your research.
Yeah.
But assuming that that's sufficient for us to move forward, can we just talk a bit about what executive function is and why parents should care about it in their kids?
Families will spend a long time seeking a diagnosis so they can get the right care. Well, that's the point.
Yeah, want to get the care, want to get the funding, want to know what's going on because the environment's not working for my child. Yeah,
that's right. However, to get a diagnosis in Australia right now, it's probably going to cost you at least $3,000, or it's probably going to
take 2 years,
and take more than 2 years, right? And then if you get the autism diagnosis, you'll get a list of recommendations based on the autism strategy and based on blah, 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 and you'll get autism-specific services. If your child gets a Tourette's diagnosis, they're not going to get anything like the sorts of services you get for autism, and they're going to get a much smaller set of recommendations.
And they get nothing for ADHD.
You've got these silos that have been generated. Now, the big problem we have in this field is why have we generated these silos? Why? I mean, we look at autism and 80%, at least 80% of kids with autism have another neurodevelopmental condition like ADHD. We know the overlap's about 60%, right? So we can just say most kids with autism have ADHD. A lot of kids with autism will also have Tourette's. A lot of kids with autism will also have language and learning disorders like dyslexia. So, like, there's a lot of overlap, but we don't talk about the overlap. We just talk about an individual diagnosis. And families spend a lot of money getting that one diagnosis. So that's the background. And what we wanted to do was go, well, hang on, let's just take something like executive function. Is there actually anything really unique about executive function delays that's specific to autism versus other neurodevelopmental conditions? And what do we mean by executive function? Well, it's executive function skills are some of the most important skills for development. So it's about planning, it's about manipulating something in your mind and then trying to come up with a solution. It's about inhibiting your impulsive responses so that you don't just do what your emotions tell you to do. You do things that are actually good for yourself and for your family. So it's these sort of higher level skills that regulate both problem solving and impulse control and what we call cognitive flexibility, those sorts of things. And so what we did is we looked at every single study that had compared two or more neurodevelopmental conditions since 1980, since autism first came into the manual, and other disorders have come in and been around as well. And what we found, in a nutshell, was the differences were so minuscule that it just wasn't worth considering as the differences were largely, there were no differences. And so we should be thinking about executive function delays and needs in a transdiagnostic way, in a way which affects all kids with neurodevelopmental conditions. Doesn't matter what the diagnosis is. Now, why is that important? Let me go back to the first bit, which is parents are spending at least 2 years waiting for a diagnosis of autism. Forget about that. I mean, don't forget about it. We still need to do that, right?
Yes, please,
but how about when you first got concerns, you start doing some executive function assessments and other things that we think you can do, and start putting supports in place straight away. And they're things that might actually help schools to manage, rather than trying to split things up with all the different diagnoses. What are the fundamental things that we need to do to support kids and families?
Just to underscore the importance of this research that you've done, Adam, it was published in Nature Human Behavior, which is one of the most prestigious clinical journals globally. And and for people who are not familiar with the term, this was a meta-analysis. So you've reviewed, as you said, all of the papers that have been written. In the end, you've synthesized more than 180 studies in this area into one condensed package. The overall picture says this. And again, my far too short summary is the overall situation is that these neurodevelopmental conditions are very much about executive function, the ability to inhibit, the ability to plan, the ability to hold on to one thing in your mind while working on another thing, the ability to switch tasks. I mean, you think about ADHD and the monotasking. A kid gets hyper fixated and then the teacher says, no, I want you to stop. It's time to do that thing over there. And the child just goes berserk. It's like, no. It took me an hour to get here and now I'm here and I'm in this and you want me to change? Like, yeah, it's so hard for them. And your research essentially found that executive function challenges appearance seems somewhat consistent across, well, almost entirely consistent across the different neurodevelopmental conditions. So here's my question for you. Does that mean, I mean, I can imagine a parent who's sitting there going, well, I got the autism diagnosis and I also got the ADHD diagnosis. But does this essentially mean that ADHD and autism are in some ways the same thing? Like, what does this mean for a parent who's trying to understand their child's diagnosis?
We're getting a better understanding that there are many common factors that underpin all neurodevelopmental conditions. So yes, that there's going to be if your child has autism, not only are they at greater risk of getting much greater risk of getting of being diagnosed with ADHD, but they're also going to have needs that are very similar to those with ADHD. even if they don't meet the diagnostic criteria. The fundamental thing is there are going to be lots of fundamental needs that cut across all neurodevelopmental conditions that we need to start to support in a more integrated way. But at a high level, I'm not saying that autism and ADHD are the same thing. There are things that differentiate and there are important things that separate them out. But I don't think our science is sophisticated enough right now to be able to say this is what's common and these are the really unique things and this is what really matters. That's the, what really matters for what we need to do to those kids in terms of providing support to give them the best opportunity. And I think it's going to be largely, a lot of the stuff we do at an intervention level is like transdiagnostic sort of stuff. It's all about getting structures and supports in place and learning environments in the right way, getting them potentially the right medications. It's stuff that doesn't necessarily need to be siloed for a specific diagnosis.
Professor Guastella is at the University of Sydney and joins me on the Happy Families podcast today. You've brought up medication. Provocative question. In my social media reels lately, a couple of things have come up. I think it has a lot to do with the fact that RFK Jr. may be coming into the United States to look after health and so on. And I've had a few reels come up that have been really pushing hard at the idea that autism, and this has been around for such a long time, autism is caused by vaccines.
Yeah.
And specifically those reels where somebody will say, I've got twins, they were vaccinated. One of them started to change their behavior a short time later. The other one didn't. One of them has an autism diagnosis. The other one doesn't.
Yeah.
The question is twofold. Therefore, what can we say about vaccines and other environmental factors and neurodevelopmental conditions like autism? And secondly, where does autism come from?
Yeah, okay. So the first question is pretty easy to answer. And it's easy to answer because there's been a lot of scientific studies conducted on the role of vaccines in potentially causing autism. And even to the point where studies have looked at the specific properties of the contents of the vaccine, such as mercury, to try and understand if there's any link associated with the specific properties of vaccines and the development of autism. Okay. Now, there's one thing we can't get away from. The one thing we can't get away from is autism is often first identified at the age of 2, and vaccines that we're talking about are often given to children at the age of 2 because that's the timeline that they're given, right? So there is this incidental, if you like, interaction where parents will often report their child receiving a vaccine and at some point in time after that noticing autism symptoms. And that's that relationship between the two is what's partly generated a lot of the worry for parents. But all these scientific studies have shown very, very clearly that none of the ingredients are associated with the development of autism. And there's been so many different ways, whether you look at countries that didn't have vaccines and then introduced vaccines and they've looked at the autism rate, or you've had laboratory studies where they've massively increased the ingredients of those specific ingredients to see how it affects development in animals for those studies. We know that there's just no relationship there. And we can say that with a really strong belief because the science around this, everyone's been so worried about it and there's been so much hysteria about it for so long. The science around it is really quite robust. The most likely reason that we have these constant conversations is because of A, the association, and then B, because there is a lot of vaccines, and we saw it with the COVID vaccines, they often get caught up into narratives around government control or big pharma. And so there's a lot of suspicion around this idea of control and vaccines. So I think it's just going to be an internal conversation that goes on while people remain suspicious about these things.
So where do you think that it does come from?
The heritability of it is the most significant factor. So that means, largely genetics. We know also, just going back to my transdiagnostic pedal, is that the genetics may not necessarily be specific to autism, but if you are autistic, or your parents are autistic, that makes you more susceptible to a range of neurodevelopmental conditions. But it's certainly genetics play the biggest factor. The rest of it is associational, and we think that the best science at the moment is suggesting, well, maybe there are things that you've got vulnerabilities there. Maybe there are things that can push you over the edge of that vulnerability to then lead you into develop the diagnosis. But you have to have that significant vulnerability there. And then there's a lot of debate around what those things could be, whether nutrition plays a part, whether living and being around pollution might play a part, stress might play a role. There's a whole range of factors which they're really hard to pull apart causally, but we think if they do play a role, it is about pushing development over a threshold where there was that genetic vulnerability to begin with. And I don't think there's any evidence that autism would develop without that genetic vulnerability in the first place.
Following through on this executive function theme, what specific strategies can parents use to support a child with executive function challenges at home?
Life is busy for many, many families, and it can get chaotic very, very quickly. And so for people without executive function delays, they might be able to navigate all the shifting needs, the different demands, reading in, just to give you an example, reading one thing and listening to another, remembering and recalling information, need to make the bed, pack my lunch, so many different things going on at once. Some people can navigate all that and get through. But if you want to make life simple, structure. So
yes.
Yeah. So kids, particularly with executive days, really, really benefit from lots of structure. So be really directive, have reminders, lots of tip sheets. And along with that, as hard as it can be, the more emotional people get, the more anxious people get, the more executive function becomes even harder. So you've just it's a calm environment, lots of structure. And then what the evidence shows is then supports around learning. So they might need, not so much because they're not intelligent, because often it's not about intelligence. Maybe it's about making sense of the information and structuring it. How do I have a lot of kids, how do I even start an assignment? I know I can almost envisage what the assignment's got to look like, but I just don't know what I need to do to start it and to put it together. So it's often having a tutor or someone or a parent to really sit down and assist them just to put the things together and develop the habits and skills that enable them to get things together. Tutors often help, and the literature shows that they could often make a huge difference around, again, not about knowledge, but around organisation and structuring things and providing reminders. And if you find your kids are like leaving everything to the last minute, then having someone that can help them start earlier and also to identify what's going on anxiety-wise when they do start early. There's probably a whole range of things going on there.
When you say structure, I start smiling to myself because given the hereditary nature of many of the neurodevelopmental conditions we've discussed today, if you've got a parent who's got ADHD,
absolutely,
and they're going, I want to help my kid to have structure, but I don't know what that is myself. Like it can be extremely challenging for them.
Yeah.
Let's step into the school context for a sec.
Yeah.
What should parents tell teachers about executive function challenges? Like, how does a parent effectively advocate for their child to get the support that they need at school, especially when there is no diagnosis yet, or there's funding challenges, or, in our case, we just withdrew our child from school because we found it was just too hard, in spite of our best efforts, to advocate for our child.
Yeah. Well, there's never a right way here, and this is an incredibly charged environment. We know that teachers and schools are particularly the public systems are under enormous pressure to deliver. So we recognise the complexity of the question you've asked, right? But at the end of the day, the kids should be at the centre of it, and the kids whose needs really matter. We want them to succeed the most. And so, to answer the question specifically, I think parents may be the best advocate, but also getting a system of support around the child is really important. So,
Yeah.
I think having a pediatrician or a psychologist or depending on the needs, an OT or speechy that can advocate alongside you is really, really useful, because not only do you bring a huge, detailed knowledge of your child, but you also bring a degree that where you need someone who's independent to communicate. So I think getting that team of support around you is really important. Secondly, teachers, are they the best place to start? There's often learning support teams, and they may be the best, if you like, educated in the space
Yeah,
to
great.
start
Yeah.
with, and then maybe the teacher in combination with them, and then also, I guess, really practical stuff that if you find stuff works at home for your child, advocating really practical stuff to the teacher is useful. As teachers have a big job to do, so being aware of what their capacity is important as well. And then this is a moving space. So one thing I've often said to parents, if the school is one that doesn't meet the needs of your child, don't be afraid to shift schools. And it may not necessarily be about the school. It may be about the teacher at that school that is just not the right fit. Don't be afraid to go to different places to get the support that your child needs, because and it also could be about the peer group. So if it really isn't working and you're finding yourself hitting up your head up against a brick wall, can get a lot of gain by getting into different schools.
One more question on executive function. How does a parent explain to a child in a way that builds their confidence rather than creating shame and a feeling that they're not enough what's going on? Like, how do you sit down with a child and say, we've done these tests and you're autistic, or we've done these tests and we think ADHD is the reason that these challenges exist. You have a neurodevelopmental condition.
Yeah, so I think that what parents need to do really is, the first thing is, we're not talking about a lot of deep stuff when it comes to executive function. It's kids needing to structure and support and, make their bed and get dressed. And if they're really struggling with it, they'll know they're struggling with it. And just being supportive in providing the steps and the structure that's needed for them to do it, but being open that maybe they actually need that structure and support, because it teaches them, not that they have a deficit, but actually if they're struggling with something, maybe there's supports they can reach out for, or maybe things that they can do to structure their own activities to help themselves. So I think that the first step is really to make sure that you're doing it in a supportive way, but you are providing different steps to help kids complete the tasks. The second thing is, whenever you give information, always give it in a really positive way. And you can remember also all the strengths that you recognize in your child. And we know that caregivers, we've done lots of studies that have shown caregivers know lots of strengths about their child and they talk about them. But when they come to sort of the problem, they'll often only talk about the problem. So just make sure you bring in some of that strength-based stuff and make sure that they feel valued and heard when you're talking about it. But don't be afraid to highlight that maybe kids, they need to do certain things to succeed, and that'll teach them how to navigate things in the future.
A technical question for you that is getting back into some cutting-edge research. There's been some fascinating studies done using rat models that have caught my attention,
right?
That suggest that the cerebellum. So for people who are not familiar with the cerebellum, it's kind of top of the brainstem, back of your brain, right at the very back, at the bottom of your brain, the back of your head, and what it does is it helps. It's attached to about 80% of the neurons in our brain, so it helps us with breathing and digestion and all of the automatic processes that keep us alive. But it's also associated with automating behaviors like understanding social cues and remembering physical actions like how to pick something up like a pen or a pencil and hold it correctly. So this research that's caught my attention suggests that since the cerebellum is so involved in automating certain behaviors properly, It potentially also explains challenges in ADHD, autism, dyslexia, dyspraxia. With ADHD, nothing automating in terms of long-term planning. With autism, nothing automating in terms of reading social cues. With dyslexia, nothing automating in terms of remembering what that letter is symbolic of or represents. In terms of dyspraxia, not remembering how to hold the pencil. Are you familiar with that research, and what do you think it might mean?
Well, I think that general idea pervades a lot of the science around autism and neurodevelopmental conditions in general. And you're talking about cerebellum focused research, but you can also put that into a frontal lobe example where you've got goal development and set shifting and switching attention. And if kids aren't paying attention enough, or they aren't able to coordinate the information enough, or they're feeling overwhelmed, then they cannot consolidate that information for learning, and they won't be able to recall that information when they need it. And so that general idea or model is, how we consider a lot of neurodevelopmental conditions to, I guess, change the way that kids learn, and where the supports are needed in terms of providing that structure and support to be able to sort of help with consolidation and retrieval.
I love that. So essentially, the executive function, the work that you've been focused on, that's the top front of the brain, right? The prefrontal cortex.
Yeah, that's right.
This is down the other end of the brain, but you're suggesting that if one of them isn't online, the other one can't function well, and so that works.
Yeah, that's right. So I think we in the 90s we thought about brain systems as different discrete components, right? So that we had this part of the brain was only responsible for memory.
I'm left-brained or I'm right-brained. Yeah.
Yeah, that's right. And I think the big shift over the last 20 years has been acknowledging that different brain systems they all interact, and if there's usually around coordination, this is why executive function is so important. If there are issues around the coordination of brain systems, it has a broad effect across. It's a connectivity issue rather than just one specific thing not doing what it should do.
Adam, you're a mountain of knowledge. The conversation's been fascinating. It's been practical, but it's also been wonderfully insightful. And my sense is that for parents who are grappling with the challenges that come with raising children who experience neurodevelopmental conditions, my sense is that you've been a ray of hope and like I said, just a mountain of knowledge and information. So grateful for your time. You've been extremely generous in what you've shared. Thank you for your input today. Is there anything at all that you think that we've either missed or that you'd just like to grab a highlighter and scribble as hard as you can so that parents really grab that one thing and hold on to it?
The one thing that I would want parents to do is to get to battle to get the support they need. Unfortunately, our system is not easy to navigate. It's not like getting your teeth cleaned. It's excuse my French, it's bloody hard. And for parents, it's going to be a long-term battle at the moment until our system is better to get the support that your child and your family needs, and to know that there are many, many other families in the same position as yourself, and to persist. That I think it's about persistence, and for those parents that are doing that, my hat's off to you, because you're advocating for your child, and it's a really important thing.
Adam, really appreciate your time. Just hearing you say that, I'm thinking of all the emails and all the social media messages that I see where parents are saying, I'm dying here. I'm just tearing my hair out. This is so, so hard. Really appreciate your compassion and the wonderful work that you do. And again, your generosity today. We've spent a lot of time talking about this today. You have so many people and so many things that are pressuring you for your time. So thank you for helping us to get this message out today.
Thanks, Justin. It's been a pleasure. I've really enjoyed it.
Professor Adam Guastella is at the University of Sydney and doing incredible work advocating for the needs of children with neurodevelopmental conditions, and he's joined me today on the Happy Families podcast. The Happy Families podcast is produced by Justin Rulon from Bridge Media. If you would like more information and resources that can make your family happier, please visit us at happyfamilies.com.au. and we'll link to as many things as we can that Adam's done in our show notes to give you that extra support.